Good afternoon, everyone. I am Carrie Watson with the CMS National Training Program. Welcome to today's webinar on the new Medicare Plan Finder. The Medicare Plan Finder is on Medicare.gov, and it helps people with Medicare compare and choose Medicare health and drug plans. If you missed the new Medicare Plan Finder webinar on August 16th, today you'll have another opportunity to preview the new Plan Finder, which was launched to the general public on August 27th. I'm joined today by my colleagues Kim Lair and Melissa Moreno, who will be helping with technical assistance. We are very pleased to welcome John Booth, the Director of the Web and New Media Group, and Ken Gardner from the CMS National Training Program. John will begin by providing you with some background information about the transition to the new Medicare Plan Finder, and then Ken will show us how it works. Ken has been presenting this training across the country and has incorporated answers to the most frequently asked questions into his presentation. We ask that you please wait to submit your questions until the end of the presentation, as we believe most of your questions will be answered. There's plenty of time at the end of the presentation for you to submit any unanswered questions. Before we get started, I'd like to go over a few technical issues with you. Audio for today's webinar is only available through your computer speakers. There is not a separate call-in number. If you have audio issues or if your slides don't appear to be advancing, you can try to resolve it by refreshing your screen, checking your computer speakers to make sure they aren't muted and that the volume is high enough, or you can try exiting the webinar and re-entering using Google Chrome or Firefox browsers. As mentioned, you can type your questions into the Ask a Question chat box located on the left side of the webinar screen. Don't forget to click Send. We will be answering questions live after the presentation. If you look further down on the left under the Ask a Question chat box, you'll see another box titled Event Resources. That is where you will find the PowerPoint slides and a job aid that are available for download and printing. Click on Event Resources and then select the file you want to download. Also, you should have received an email earlier today with links directly to the PowerPoint presentation, the job aid, and our NTP website link, as well as a link to access closed captioning. Closed captioning is available for those who require a text version of this training event. If you need closed captioning, click on the closed captioning link and enter the event ID that was in the email you received earlier, or we will post the link and event ID in the webinar room in just a moment. We will also post the presentation slides, job aid, and a recording of this webinar training on our NTP website, CMS National Training Program.cms.gov, within a week of today's webinar. This CMS National Training Program webinar provides basic information. You should always consult the relevant statutes, regulations, and rulings for official legal guidance. This call is intended as an informational call for partners. It is not intended for press purposes and is not on the record. If you are a member of the press, please email our press office at press@cms.hhs.gov. Now I'm going to turn it over to John Booth to get us started.
Thanks, Carrie. Thanks everyone to everyone for being on this webinar today. As you all have heard by now, we did launch the new Medicare Plan Finder to the public last week. I hope you've all had a chance to start trying it out. We've already received feedback from many users, so we thank all of you for taking the time to tell us what you think. We'll try to address many of the most common questions that we've heard here today. In case you missed the previous webinar, I want to start with some background and context for this project before Ken walks you through the user experience in the new Plan Finder. As you know, Medicare Plan Finder has been around for a while, and year-round it's consistently one of the most widely visited sections on the Medicare.gov website. But it hasn't really changed much over the past 10 years, even as we've seen beneficiaries become more computer savvy and are increasingly using smartphones and tablets and have honed their expectations of a good website experience with other popular shopping, banking, and comparison websites. So demand for improvements was there. That's why we made the development of a new redesigned Plan Finder a priority project for this year as part of the larger e-Medicare initiative. And there were other important technical and contractual drivers behind the scenes as well, which made it essential for us to develop and launch the new Plan Finder before the upcoming open enrollment period begins this October. With last week's public launch, it's especially important to say that development of this new Plan Finder is an iterative process. That's part of the reason that ongoing feedback from users is so important. When we first walked through some of these screens with SHIPs and Senior Medicare Patrol members at their conference in July, they pointed out concerns around the display of in-network versus out-of-network pharmacies, as well as the display of optional supplemental benefit packages. We were able to prioritize building additional functionality before the public launch to directly address those concerns in the version that we did launch last week. As we've heard new questions since releasing the Plan Finder to the public, we continue to use that feedback to guide our development. For example, several of you have noted that there's no simple way to sort plans based on total annual out-of-pocket costs. That would be a number that includes both the drug costs and the plan premiums. This is a feature that's always been on our list to include, but couldn't be completed in time for last week's launch. The good news is that we're on track to have that in place for this open enrollment. That said, there are also some features that we won't be adding. Part of the goal for the new Plan Finder is to create an experience that works well for people with Medicare and also moves the tool forward to bring it in line with modern customer expectations and conveniences. Today, most websites that offer the kind of personalized information we want to provide require you to create an account with a username and password. Over time, we've learned that this is how to best protect users and ensure that they have the most secure experience. Some of the changes we've made to the new Plan Finder, such as eliminating the ability to restore and retrieve a drug list with an anonymous drug ID, move the tool towards stronger security and privacy protections for beneficiaries, and that's something that we won't compromise. We know that some of these changes can be frustrating and might drive the need to adjust some of your business practices, but we think the benefits to people with Medicare will ultimately make those changes worthwhile. Our team is committed to providing whatever support we can to help with the transition. And we'll start by using the full 90-minute schedule for today's webinar and address as many of your questions as we can. Now I'd like to turn things over to Ken Gardner for a demo of the new Medicare Plan Finder.
Thank you, John. So let's take a quick look at this new Plan Finder. I want you to note that these slides were created using screenshots from the prototype system before the new Plan Finder launch to show you how it works. The data is fictional, and since these are screenshots, it isn't possible to scroll down to see everything. So I've cropped the images to enlarge the key points. Also, these screenshots were taken from the prototype site, and the live version just launched has some updates, so they may look just a little bit different from what you see here. This is the landing page for the new Medicare Plan Finder. If you already have a MyMedicare.gov account, you can just use the username and password that you've already created. Or you can easily create a new account, or recover your account if you forget your login information. Down at the bottom are two boxes. One is for people who qualify for a special enrollment period and are seeking to change their 2019 coverage. The other is for people new to Medicare who want to learn more about their coverage options. For our purposes today, we're going to talk about Jane. She's our fictitious person with Medicare who wants to find out about her coverage options. But Jane isn't quite sure she wants to log in, so we'll look at the anonymous process first. We've added a yellow arrow here to show the button that she would select to continue without logging in. You can think of this like checking out on an online shopping site as a guest instead of signing in or creating an account. It works, but you have to provide all of your information instead of the site picking up information that is stored from your last purchase, like your shipping address, for example. you're new to Medicare, the Plan Finder asks what sort of coverage you want, or you can select I'm not sure because you're looking to learn more. So let's do that. Now Jane also needs to add her zip code because she's not logged in. The system also needs to know where Jane lives so it can show the Medicare plan options available in her area. So she puts in her zip code and then selects Next. Jane is presented with the two ways that she can choose to get her Medicare benefits, Original Medicare or Medicare Advantage. She can look at both and start with either one. In this case, she selects Original Medicare first. Here, Jane learns the basics of Original Medicare. Since the selection on the left, notice that the selection on the left has green checks and red X's to show what is and isn't included. And again, all these yellow arrows that you're going to see are not in the system. They're just added to point out features that we want you to notice. The box on the right gives her information about premiums and co-payments, as well as options like a Medigap policy and a Medicare prescription drug plan. There's also an information box that if you want a Medigap policy or a drug plan, it's best to get it when you're first eligible. Down in the lower left is the Medicare premium that most people pay, the Medicare Part B premium of $135.50. Now let's say Jane wants to explore adding a Medigap policy. She checks the box at the top and the information about Medigap is shown. On the right, a description of Medigap policies is given with personalized pricing for Jane's area based on the zip code that she entered earlier. It's a range of prices because she can choose from a range of Medigap plans. You see that the red X on the left changes to a green check next to help with out-of-pocket costs, showing how her coverage changes overall when she adds a Medigap policy. And the premium information at the bottom is updated to include the range and the cost of premiums for Medigap policies in her area, and a total for the options that she's chosen so far. Next, Jane wants to see what happens if she adds Medicare drug coverage. She checks the box at the top for a drug plan, a Part D plan, and she leaves the Medigap box checked as well. Now the box on the right gives basic information on Part D plans, including personalized premium prices in Jane's zip code. Note that the information on Original Medicare and Medigap policies, it's still there, but it's minimized. She can select the arrow to open it up again if she'd like to review that. A green check now appears next to drugs in her coverage list, showing that now she has pretty complete coverage, except for the things that Original Medicare doesn't cover, like vision, hearing, and dental. And lastly, the price range for drug plans is added at the bottom. Notice that the information for all three options that she has checked is included together, which is much easier to understand than if you consider each option separately. Now Jane wants to see what options are available under Medicare Advantage. She checks that box. Notice that when she checks it, it clears the checks for Original Medicare, Medigap, and drug plans, since you can't have any of those when you choose Medicare Advantage. Now the information box on the right gives a general explanation of Medicare Advantage plans, including the premium price range for Jane's zip code. The coverage list on the left now changes to green checks besides most of the items, but a red X is showing that she can't go to all doctors that accept Medicare. That's key information that people with Medicare need to know to make an informed decision. The premium information at the bottom is updated. It shows that you still have to pay your Part B premium in addition to any Medicare Advantage plan premium. These may seem like small things, but they fit with the way people think and emphasize the information they need to make an informed decision. Now we'll discuss logging in or creating a MyMedicare.gov account. I usually get questions about what you do if you forget your login information, and I'll cover that toward the end of this talk. It's really quite easy. So now that Jane has a better idea of what's available and has decided to log in for a more personalized experience. But let me answer two common questions about the anonymous experience that we just saw. First, you can go through the system without logging in and still enroll in a plan when you get to the end of the process. Second, if you created a drug list and you want to save that information, the only way you can do it is to log in before you end your session. If you don't have an account, you can create one. It will still save the information. But the only way information is saved is when you're logged in. If you do it anonymously, that drug list won't be saved. So Jane's going to click the Login button. And at this point, she can log in with her MyMedicare.gov account information, or if she doesn't have an account, she can easily create one. Let's look at how to create an account. And we'll just select the Create an Account button. Creating an account has been made easier. It takes 2 steps instead of the 4 steps that it used to take. Now, since I'm using screenshots, I can't scroll down and show you, but it's really only 2 screens. First, you enter your Medicare number, your last name, and your email address. There's a checkbox if you don't have an email address or just don't want to give it. So just to emphasize, the email address is optional. Scrolling down just a bit, you enter your date of birth and a zip code for the city where you live. Then the effective date for Part A from your Medicare card. If that sounds familiar, it's because it's the same information that you would enter into the Plan Finder before, except that you can also add an email address if you like. So then you just select Continue. Next, you pick a username. Now the username must be unique, so an email address is a good candidate, but you can pick anything you like. Pick your secret question from a list of options and add your answer to that question. Then choose a password. That's all there is to it. It's not very different from creating an account on an online shopping site, and most people with Medicare already have one of those. So our prototypical person with Medicare, Jane, chooses a username and wants to use her mother's maiden name, Doe, as her secret answer. She then adds a password and selects Continue. She's taken back to the login page, and there's an information banner at the top showing she successfully created her account and explains that she'll get a confirmation letter in the mail within 10 to 14 days. But Jane doesn't need to wait for that letter. She can log in right away. So Jane logs in with a username and password that she just created. Now she sees her current coverage information. It turns out that Jane has had Medicare since February of 2017 and is eligible for both Medicare and Medicaid. She's currently enrolled in a Medicare Advantage plan through Kaiser Permanente. Remember, this is fictitious data just for educational purposes. So Jane's decided to see what her Medicare Advantage plan options are for 2020. She checks the box to confirm. You'll also see at the bottom of the slide that the system has picked up on the fact that she's in her second initial enrollment period, since she originally gained her Medicare entitlement through disability before she turned 65 earlier this year. The next screen asks whether she'd like to compare drug costs. She's checked the box saying that she does, so a box opens telling her how to get ready to enter her drug list. The next question is about whether Jane uses a retail or mail order pharmacy. Jane has some prescriptions mailed to her home. And she also has some filled at the local pharmacy in her MA Plans network, so she selects both. This screen shows the personalized power of the MyMedicare.gov claims database. Jane gets a list of all the prescription drugs that she has filled through Medicare in the last year. She just has to check the boxes next to the ones that she still takes. This level of personalization is only available to users who log into the Plan Finder with their MyMedicare username and password. I apologize, I see my slides have stuck. So this is that claims-based list of all the drugs that she's filled in the last 12 months, and she can click on the ones that she still takes. So Jane still takes Capve and Microzide, so she selects each of those. The others are drugs that she doesn't take anymore. Next, the system prompts Jane to confirm that the dosage and quantity that she used before is still correct. If she takes a different dose or quantity now, she can make that change. But these are correct, so she selects the green box to add these two drugs to her list. Now she gets a screen confirming that these drugs have been added to her list for pricing 2020 plans. By the way, one of those suggestions that came up from the SHIP conference a few weeks ago matched some early feedback from the call center, that going through the drug list twice, once by name and once to confirm the dosage, may not be the best way to do it. So we're adding a button that you can click just to accept all the drugs into your list, and then you can confirm each one along with their dosage, or just click remove for anything that you no longer want on your list. So Jane also has some new prescriptions that she'd like to add to her list. So she can select either of the Add Drug buttons to do that. This is the screen that she'll use to start adding drugs to her list. When Jane starts typing in the box, she'll get suggested drug names. In this case, Jane wants to add Humira. Once she types HU, it appears on her list. She can keep typing or select from the list once she sees it. Jane selected Humira and now selects Add Drug. If she made a mistake, she can just click the X to delete Humira and type in a correction. When adding a new drug, the most common dose and quantity is pre-populated. Injectable drugs also have a packaging field. Jane adds the dosage, packaging, and quantity, then selects Add Drug to my list. Now the system shows her drug list, and she can add more drugs or select Continue. She takes one more prescription, so let's add that. Again, she can start typing the name of the drug. She starts to add Lipitor. Notice that once she types LIP, the brand name Lipitor, and the generic option atorvastatin, both pop up as a choice. Jane chooses Lipitor from the list. At this point, the system generates a pop-up showing the generic alternative, pointing out that it's a lower cost alternative to Lipitor, and asks if she'd like to add generic or add the brand instead. Jane chose the generic and can now confirm her dosage and add the drug to her list. So she sees her drug list again, and now she's got a total of 4 drugs on her list. That completes her list, so she's going to select Done. Now that Jane's drug list is complete, she's prompted to choose some pharmacies near her for the drug pricing engine to use. Since Jane said she uses mail order pharmacies too, that's already selected as an option. She can now pick 2 retail pharmacies in addition to mail order. So Jane checks her favorite pharmacy. And she also chooses an alternative pharmacy. Then she selects Done. The system now has everything it needs to price her medications along with each plan option that's available to her. Since Jane started this process by saying that she wanted to look at Medicare Advantage plans, let's go through the Medicare Advantage search and compare process. You're going to see that now it's a lot easier to see and compare the Medicare Advantage plans in your area, including the ability to search by one of the new benefits that the plans may offer in 2020. We'll look at the Medicare prescription drug plan process after we're done with this. Once Jane has finalized her drug list and picked her pharmacies, it's time to compare plans. On the live site, you'd scroll down to see the plan results, but we'll use screenshots to show you this piece by piece. This is the top of the page, and as you can see, there's a live chat button up on the right. That's another feature of the new Plan Finder that's only available if you log in. Our research shows that seniors often have questions when they start comparing plans. So again, this feature is only available if you've logged in, and you can chat real time with a customer service representative at the 1-800-Medicare call center from anywhere in the new Plan Finder. This page also shows Jane's current Medicare Advantage plan with 2020 pricing. And if you think her drug cost here is low, just remember that in our example, Jane is a dual eligible beneficiary. She's eligible for both Medicare and Medicaid, so she has very low cost sharing for her drugs. There's also an option to filter her plans for personalized choices. So let's stop for just a moment and take a look at the Legacy Plan Finder on the left and the new Plan Finder side by side. Now the details may be hard to read because this is so small, but notice how much easier the new Plan Finder on the right is to read than the one on the left. Both show the basic information for a Kaiser Permanente plan in this particular example. Virtually all the information on the old screen is present on the new screen. Hopefully you can see how much easier it is to read and understand. And there's always somebody in the audience that's got really sharp vision. If you look very closely, you'll see the left-hand image is from the Legacy Plan Finder. It is a San Francisco-based Kaiser plan. Jane's plan on the new Medicare Plan Finder is a fictitious example, a Kaiser plan in Boston. So you can't really compare those details from one to the next. So Jane sees that there are 26 options, but she'd like to narrow that down a bit before she tries to make a decision. So she selects Filter Plans. After Jane selects Filter Plans, the available filters display. I've highlighted the filter control panel on this slide. The filter options are meant to allow you to see available plans based on the criteria that's important to you. Are you looking only for a plan from a particular insurance company? Do you want only a 5-star plan? Maybe you want to make sure that you find a Medicare Advantage plan that includes every medication on your drug list in their formulary and that also has transportation benefits. You can select any or all of these filters and you'll get a list of the Medicare Advantage plans available in your area that meet your personal criteria. This filter wasn't available on the old Plan Finder, and it's a very powerful function. Under this filter panel, you'll see Jane's current plan. So after Jane picked her filter, she can see that 10 of the 26 plans in her area meet the criteria that she chose. We're going to compare plans to see how these measure up to her current plan. If you scroll down, you can see the basic information on all 10 plans. At the bottom of the screen, you'll always see the plans to compare bar. That's a static bar that remains at the bottom of your screen as you scroll through the list. We'll just pick 2 plans to compare. So Jane picks Humana Gold Plus and Blue Medicare Advantage Classic. She just checks the box, Add to Compare. You can see on the Plans to Compare bar at the bottom that it shows which plans she has selected. So now she selects the Compare button to take a look. This is the Plan Compare page, and Jane can scroll down to see how the plans compare in a variety of ways. She can also select the Plan Details button to get more detailed information on that particular plan. So let's select the plan details to see the information provided. Under Plan Details, you get to a page with very detailed information about that plan. Information is organized to show you what we think is the most important for persons with Medicare to know when they're comparing plans, based on the interviews that we've done with seniors. Given that there's so much information on this screen, I've divided it into multiple slides to give you some context. So here is the basic premium information and estimated costs. Scrolling down, you'll see copayment information for seeing a doctor, diagnostic tests and imaging, emergency care, hospitalization, etc. The things people usually consider first when they're looking at a plan. Going down further, here's information on preventive services, physical therapy, mental health services, and more. You'll see information on durable medical equipment like wheelchairs and hospital beds, hearing and preventive dental services. Comprehensive dental is listed separately from preventive dental, since many Medicare Advantage plans pay only for preventive dental services. Vision services are also listed. Additional benefits like a fitness benefit, over-the-counter drug benefits, and more are listed as well. And special benefits that might apply if you have certain qualifying chronic conditions. And last but not least, Part B drugs and star ratings. If you expand the star ratings page, you'll get in-depth information about each quality measure included in that rating. The point in showing you all these slides is that there's a wealth of information there if you want to look at it. But the information that most people focus on is presented very early in the process. So let's go back to the top of the Plan Compare page and assume that Jane wants to enroll in a plan. She would just select the Enroll button. She'll get a pop-up for the plan she selected. I'm not going to take you through the enrollment process. For 2019 plans, it's the same as it has always been, but for 2020 plans, we've created a new enrollment center as well that has the same look and feel and quite a few fewer pages to make it a simpler process. Now let's take a quick look at the prescription drug plan search and compare screens. When you look at PDP results, you'll see there's a very similar look to the Medicare Advantage pages. Note that at the top of the page are links that will take you back to Medicare Advantage results instead, or a button that will help you explain the difference between a drug plan or a Medicare Advantage plan. Let's take a look at the Filter Plans functionality. After selecting the Filter Plans button, the personalization options come up. For PDPs, there are really only 3 filters. Drug plans that have all medications in your personal drug list on their formulary, star ratings, and insurance company. This is because those are the basic elements in most people's decision process. In this example, there are only 4 drugs on the list, so we won't filter them. But we'll start choosing plans to compare. After we choose the plans to compare that we want to look at, we click Compare. We've cropped this view to only show the key information, but you can see that the basic information for all 3 plans selected is shown right up front. Note that this particular screenshot is not based on Jane, our previous example, but on an anonymous search without any drugs on her list. So this is similar to the many times that you work with clients that are seeking help choosing a plan, but they say they don't take any medication. They just want to be covered in case. So If you select Plan Details, the plan details are pretty simple when there aren't any drugs on the list to price. Without any drugs to price, an average figure for people with Medicare is displayed. With the drug list, you select the down arrow to get detailed drug pricing information. So I also wanted to give you just a peek at the live site for the new Medicare Plan Finder that was launched on August 27th. This is an example of a PDP search for an actual person with Medicare on the live site. You can see how the drug costs are reflected for both retail and mail order pharmacies. If you click on the plan details and look at the drug cost detail, this is what you'll see. Note that this particular example is in a Kaiser HMO that has its own pharmacy. If you were to price the local Walgreens pharmacy instead, she'd see it's an out-of-network pharmacy and the retail price that she would pay. The public launch is a version from August 27th is a version of the Medicare Plan Finder for 2019 plan data. It includes a toggle to take you back to the legacy Plan Finder if you prefer to use that. But for 2020 plan data and enrollments, a more robust Plan Finder will be in use, and it will be your only option for 2020 plans. So to summarize the key changes, the look and feel is cleaner and easier to read. The site is optimized for mobile devices. You can now price a mail order pharmacy plus 2 retail pharmacies at the same time. Drug lists are suggested based on your prescription drug claims over the last 12 months. But you must remember that the existing saved drug lists will not transfer to the new Plan Finder, and the drug list ID numbers are no longer available for anonymous searches. Also, you can now price up to 40 drugs on a list instead of 25 in the previous tool. Now, I mentioned earlier that I'd show you what to do if you or your client has forgotten some of their My Medicare login information, or if they're unsure if they have an account. So let's go through that quickly now. If you've forgotten some of your information, just click on Trouble Logging In, like you would do with many websites. Here you've got 4 different paths, depending on whether you forgot your username, your password, both your username and password, or if you're not sure if you have an account at all. Let's start by seeing how you recover your username. If you need to recover your username, you must enter some basic information: your Medicare number, last name, and date of birth. Then you answer a simple question to show you're not a bot. You don't need to do the full CAPTCHA with all those pictures. In this case, you're asked to type the last 3 numbers of 11783. So you type 783 and click Continue. And you see this screen reminding you that your username is Mighty Mouse in this particular instance. If you've forgotten your password, you just click this link. You put in the same information: your Medicare number, your last name, date of birth, and your username. Then you answer another simple question. In this case, type the first and last numbers of 263. Then click Continue. This is where that secret question and answer comes in. You're reminded of the question that you chose, and in this case, in what city did you first meet your spouse? You enter the answer and click Continue. And there you can change your password, and the password guidelines are on the right-hand side. If you've forgotten both your username and password, you just click that link and you'll see it looks very similar. You'll need to enter the same information as before, and this time you get my personal favorite question: what color is the purple pen? You're reminded that your username is Mighty Mouse, and you click Continue. And you'll be reminded of your secret question. Answer that correctly, press Continue again, and then you can choose a new password. Lastly, if you aren't sure if you have a My Medicare account, you can click Verify Your Account Access. You put in the same information as if you'd forgotten your username. And you'll be taken to a page that tells you whether you already have a My Medicare account. In this case, this person does have an account that was created on July 11th, 2019 by the beneficiary versus a 1-800-Medicare rep, for example. And your username is Mighty Mouse. With that information, you can recover your password and you're all set. So we're coming up on questions, and as my colleagues pour through the many questions that we're getting through the chat, let me start by answering some of the top questions that I've been getting on the road about the new Medicare Plan Finder. First is, if my client doesn't have a Medicare number, yet wants to shop, how do they do that? You can do an anonymous search. You just don't use the Continue Without Logging In button, and you can search without a Medicare number. You just can't save that data until you have a number and create an account. Next question, can we still use the drug ID and password date? No matter how many times we say it, we keep getting this question. Only for the old Medicare Plan Finder for 2019 plans can you still use that drug ID and password date. If you want to access that drug list, print it in the next few weeks. Then it's going to go away. As John said in his introduction, the drug list ID and password date will go away with the Legacy Plan Finder, and it's not coming back. So you've got to use the new Plan Finder for this coming OEP. A very common question is, what if my client doesn't have internet access or doesn't have a computer? Well, that's why they're working with you, isn't it? You know, if they may have a smartphone or access through a library or another person's computer, or they're probably relying on you for your help. In any event, they weren't using the old Plan Finder with that computer they don't have either. And there seems to be a lot of confusion about whether you need to have an email address and whether you can recover your account without one. Will they email something? Do they need to email you to recover the account? You do not need an email address to use this system. We do encourage you to enter that information when you create your My Medicare account if you have one. We get the question a lot, if you do an anonymous search, how do you save it? If you create a drug list while you're in the anonymous search, that is without logging in, then you can either log in or create an account before your session ends, and that data will be saved. If you close your browser without logging in, no data will be saved. That drug list will be lost. I'm also asked, will the new Plan Finder be available in Spanish? And the answer is yes. It's available in both English and Spanish. And lastly, for the SHIPs, the State Health Insurance Program counselors, we're often asked, will SHIPs be allowed to maintain usernames and passwords? So guidance came out from ACL, the Administration for Community Living, on August 28th. In short, yes, SHIPs can maintain this information, but they need to be thoughtful about its use and keep it secure. Usernames and passwords cannot be stored in the STARS system that the SHIPs use. So those are the most common questions I've been receiving. What other questions do we have?
Thank you, Ken. And for those of you, I know a lot of you have submitted questions already, and we're going to begin going through some of the questions. But you may also take this time to submit other questions to the Ask a Question chat box located on the left side of your screen. And I will begin asking these questions, and I realize some of these questions we may have just addressed, but because they seem to have come up quite a few times, we will go ahead and review those again. Okay. Will Medicare agents still be able to do any kind of plan comparison for their clients?
Absolutely. That's the whole point of the new Medicare Plan Finder. You can do those plan comparisons in two different ways. You can do it without logging in, without creating an account, but you won't be able to save that information and you'll have to enter everything like the drug list manually. Or you can help your client create a My Medicare account, which only takes less than 60 seconds. Create that account, and then you can log in and get that claims-based list and do the full comparison, and all of your work will be saved.
Okay. Once we enroll a client in mymedicare.gov, will their username and password be activated immediately?
Yes, absolutely. You're taken back to the login page, and you can log in right away.
Okay. When opening a My Medicare account, it states that you don't need an email address. Is this correct? Do they send their confirmation by mail?
You do not need an email address. I know a lot of seniors don't have email. There is a confirmation letter that comes just as a security measure, so that if someone else had created a My Medicare account for them, they would know about that. But there's no confirmation that goes through email. You get confirmation right on the screen and can log in right away.
Okay. The next question is for John. Will 2020 pricing data be available to interested parties in a downloadable format?
Yes, it will. So as in previous years, the agency will make available the landscape files and the public use file that will include the information for 2020 plans. So those will both continue to be available this year.
Okay, thank you. And one more for you, John. When will the old Plan Finder be unavailable?
So the old Plan Finder will be unavailable once enrollment begins for 2020, so at the 1st of October.
Okay, great. Thank you. Okay, back to you, Ken. How can an agent use Plan Finder to help a client choose plans?
Well, that's pretty much what we just showed. If you work with that client, help them create an account, you can find out what drugs that they've been filling, assuming that they've been in Medicare for some time. If they're new to Medicare, you'll have to ask them what drugs they're taking now. And with that information, you can search Medicare Advantage plans and prescription drug plans to find out what is the most cost-effective for them in the coming year. And of course, you can also enroll them through that, or if you're an insurance agent, you'd probably do that through your proprietary site.
Okay. Can we look at the live version instead of screenshots?
Well, they used to say in television that you never want to work with children or animals because something might go wrong, and that's why we didn't try and do a live demonstration through a webinar service like this. But absolutely, you can go to Medicare.gov, click on Find Plans, and look at it to your heart's content.
All right. And are the 2020 plans live?
Not just yet. 2020 plan data will be coming in soon, and I think it'll be live approximately October 1st. Same schedule as in previous years.
If you don't want to set up an account, can you still use the Drug Plan Finder?
Yes, you absolutely can. That means you click that link to continue without logging in. It means you will not be presented with a claims-based list. You'll have to enter each drug separately and use it just for that session. You can print out that list, but that list will not be saved unless you create an account. And once again, if you've gone through that anonymous process and you've put a lot of work into it, if at that point you create an account, then that information will be saved.
Okay. So a person can use the tool without signing it. It just won't store information. That's the question.
That's right. You know, it's a lot like when you're on an online shopping site, and if you don't log in with your account, you can still buy things, you can still put in your credit card, you can do all that, but it will not save any of that information for later, and it won't send you updates and things like that. So in this case, creating that account gives you access to more features. It gives you access to that claims-based list, which is incredibly valuable for anyone that's not brand new to Medicare. It also allows you to connect to the live chat, to save your work as you go along, to see people's current enrollment status, whether they've got any kind of extra help or other subsidy. There's a lot of information available. We really encourage people to create accounts and log in. So for beneficiaries, for people with Medicare, it's a good idea. It gives them more access to information. For SHIP counselors and insurance agents, it will save them a huge amount of work. And so we really recommend creating an account and taking advantage of these new features that are available.
Okay, next question. How long will we be able to access the old system?
Only until approximately October 1st. So if you need to do that, if, for example, you've got a saved drug list and one of those drug list IDs and password dates, and you want that information, we recommend that you go in the next 2 weeks, pull that up, and print out that information, because once that system goes away, you will not be able to access that list at all.
Okay. Where the premium is reflected, will it have reference to higher income earners and their associated premiums?
That's a really good question. Really you're asking about IRMA, the income-related monthly adjustment amount. If that person has already been assessed in IRMA, then I think it may show, but I'm not positive. We'll take that back to confirm it. But oftentimes, seniors are assessed, it's based on their tax return from 2 years ago. And so even though they don't have an IRMA this year, they might have one next year. So it's always good to double check that information.
All right. When performing an anonymous search, is the new to Medicare user forced to go through the learning screens? Can the user skip over these steps?
Yes, absolutely. Those learning screens, as you called it, we call it the coverage wizard. You get there by clicking the button saying, I want to learn more about my choices. But you can go straight forward to pick plans if that's what you want to do, or you can just look at one or two of those screens and proceed from there. It's totally flexible. You can choose the path that you want to use.
Okay. Why is the purpose of now making you log in to save your drug list, especially when this was previously not a requirement? And I think they mean, what is the purpose of now making you log in to save your drug list?
Well, as John talked about in his introduction, it's really a security feature. In today, 15 years ago, when the current Plan Finder was launched, cybersecurity was not nearly so much on people's minds as it is today. But now we want to make things a little more secure. In order to save that drug list or access a new list, we want to know it's the proper person connecting, and so we want you to use that account. But you still have the option of not logging in and using that system anonymously.
Okay. John, I have one for you. How many U.S. consumers already have a Medicare account?
Yeah, so yeah, we have a lot. At the moment, there are just over 2.3 million users with My Medicare accounts. So those are beneficiaries who created accounts.
Okay, thank you. Ken, back to you. What if you try to create a My Medicare account, but you already have one and just didn't remember? Does the system recognize this and stop you from creating a new one?
That's a good question. I'm not sure that, John, do you have the answer on that?
Yeah, that's correct. If you do already have an account, the system will prompt that one exists and have you go through the recovery process there. I will also highlight the 10.3 million number I cited. Those are active accounts. We did have many users who had accounts set up in the past and had never used them. Those have been deactivated, so if a user had one and had never used it, they'll just start fresh and create a new account. But anybody that had one that was ever active, they would be prompted to go through that account recovery process, or 1-800-MEDICARE could assist with that as well.
Okay, thank you. Where do we send our concerns about the new Plan Finder?
There is a mailbox for that. Well, first of all, SHIP counselors, there is a process through the state SHIP directors, and you would send your information there. Also, John, I believe we have an email address to which people can send their concerns and suggestions.
We do. That email box is emedicare@cms.hhs.gov.
Thanks. I was drawing a blank on the name.
Okay. As brokers, we run beneficiary drug lists through the site, and we get a password to go back in, so we do not have to re-enter the drug list. Can we still do this?
The answer is no. We've been talking about this drug list ID number and password date, and that's the functionality that won't be available anymore. However, if you work with that client, set up a My Medicare account, and log in with that information, then your drug list will be saved. However, the drug lists that are in the legacy Plan Finder system will not be transferred to the new Medicare Plan Finder. So you're going to have to create a new list. But when you think about it, if you've logged in and you're getting a list of all the prescriptions that person has filled through Medicare in the last 12 months, you really don't need a drug list that you created last year. The claims-based list is going to be more accurate.
All right. Next question. If a username is already taken, will you have to create a new one, or can multiple people have the same username?
Usernames must be unique. Just like on a shopping site, any site you pick, you're going to have to create a unique name. So, we've suggested that one thing that is unique probably is your email address, if you have one. So that's one option. Or it can be Mary Smith plus your zip code, or whatever you choose. But it's going to have to be a unique username.
Okay. Let's see, is there still a way to input the Medicare number, date of birth, zip code, and effective dates to see if a person has extra help without creating a login?
Again, it's a security and privacy issue. We're only showing personal health information like their subsidy status for logged in users.
Okay. When you set up an account when using the Plan Finder, does that establish the My Medicare account at the same time?
Yes, it's really the same account setup system, even though you're in the Medicare Plan Finder site. If you were to go through mymedicare.gov, you'd see that the create an account page looks identical, the login page looks identical. So the same username and password is used on both systems.
All right. Will the drugs auto-generate for people who haven't had a MyMedicare.gov account previously?
So long as they have had Medicare and they've been filling their prescriptions with Medicare coverage, they will show up on our list. We realize that many people will be creating new MyMedicare accounts. I did this personally for a relative of mine just last week, and all of her claims, or all the prescriptions she filled in the last 12 months showed up on the list for me to pick that. But that does trigger one of the thoughts. So when you first come into the system, you're going to see that claims-based list for the last 12 months, and you can save each drug into your drug list or remove it if it's something you didn't take, like an antibiotic that was only very temporary. If you log out and come back in again, what you're going to see is the drug list that you saved. You're not going to always have to start with every prescription you filled in the last 12 months.
Okay. Can we get a side-by-side detailed comparison all on one page?
I'm going to assume you mean detailed comparison of Medicare Advantage or drug plan. If that's true, on that plan comparison page, you can look at 3 plans at a time. And I only showed one slide on that, but if you were to scroll down, there's a lot of information on that comparison page. If you want to look at in great detail at a plan, you click on that plan details page, and that's only available one at a time.
All right. Will the drugs, maybe we had this one. Let's repeat in case. Will the drugs auto-generate for people who haven't had a My Medicare account previously?
Yes. So again, that drug list, that claims-based list, will generate for everybody, even if that My Medicare account is brand new. The only caveat is that they have to have filled those claims through Medicare. If they're just turning 65, if they've just gained eligibility through disability, what have you, and have never filled a prescription through Medicare, then there's nothing in our system to populate that list. But for someone who's been in Medicare for years, just created a My Medicare account 5 minutes ago and immediately logged in, their claims show immediately.
Okay. Is it the username and password or the MBI information that allows me to save the drugs?
Okay, so the MBI is the Medicare Beneficiary Identifier, is the new Medicare number for anyone who didn't know that acronym. But it is the username and password from My Medicare that allows you to save the drugs. Just entering a Medicare number is not adequate to save the drug list.
All right. Oh, here's one. Can you look for a Medigap plan on this site?
Absolutely. You should have received prior to this webinar a link to the slides that I just showed, as well as a recording of this. If you go back and look, you'll see a big part of that was we were searching for Medicare Advantage plans. And that is a primary purpose of this site, is to be able to look for Medicare Advantage or Medicare prescription drug plans. So yes, you create that account hopefully, or you go in without logging in, and you can compare the plans that are available based on your zip code of residence, because that's one of the requirements to belong to a plan, is you have to live in their service area. You'll see all the plans that are available to you and can filter that down and choose a plan and enroll through this site if you so choose.
Okay. Can several people have the same password?
Yes. The username has to be unique, but passwords they're a secret. We don't know what they are, and they do not have to be unique.
Okay. The added benefits for a Medicare Advantage plan, such as transportation, will a list of providers be available through the Medicare site?
So I'm assuming by that you mean transportation providers, or you could mean providers as in doctors or hospitals that are in the network for that particular plan, and that's a very good question. So right now, you cannot search by a particular provider in the Medicare Plan Finder. We have links back to that health plan's website where you can look at the provider directory, where you can contact the health plan in that way, or if you have a favorite doctor, you can ask that doctor what plans they take and start there. One of the things that's sort of in the pipeline, CMS has proposed a set of interoperability rules that's currently in the public comment period, and if those rules are passed, health plans will be required to give provider directories and other information to CMS in a machine-readable format, and that's the first step. That would give us the information that we would need to then be able to create a provider search function. But that is not available this year and may take a while to develop.
Okay. Can a beneficiary self-enroll in a plan through Plan Finder, or do they have to enroll through an agent?
Yes, beneficiaries can absolutely enroll. Part of the redesign of the Medicare Plan Finder is to make it more user-friendly for people with Medicare, for that direct individual beneficiary. And there are many people that use the Plan Finder now, have used the Legacy Plan Finder to locate a drug or health plan and enroll into that plan, and we think it'll be even easier for them to do so with the new Medicare Plan Finder.
All right. Is My Medicare account the same as the blue button, or has the blue button designation gone away? John, do you want to take that one?
Sure. So basically, to authorize one of the Blue Button apps to access your Medicare data, you would use a My Medicare user account. So they are the same accounts. Blue Button is generally something you're doing with another application or another tool, not our website, but the accounts are the same.
All right, thank you. Does the Plan Finder give ratings for Medicare supplement plans?
It's a good question. We'll take that back. I believe the answer is no. Remember that Medigap plans are actually regulated by the states. CMS sets the overall structure of the benefit, but they are regulated by the states, and I do not believe that we give ratings for Medigap plans, but we'll take that back and I'll find out.
Okay. All right. Let's see. Can you see Medigap plans specifically for your area and age?
When you say see them specifically, I'm guessing that you're talking about pricing. So you can get general information about Medigap plans in your area, showing what the benefit is, which companies offer them based on your zip code. But you would need to, but we don't have specific pricing for different ages and such. You would need to contact the plan or an insurance agent to get specific information on that particular plan. We just give general guidance there.
Okay, and we do have quite a few Medigap questions that we've just gotten in, but can you just repeat, this question is, can we compare Medigap plans using this tool? Just reiterate that for us.
Yes, you can. A big part of the tool is education, and there is a Medigap section which will help people understand the different types of Medigap policies that are available, the Plan G, the Plan F, the Plan C, all the many plans that are available, and of course that varies from state to state. So it's primarily education, but then it also shows what companies offer plans in your particular area, and you can ask for more information from there.
All right. next question, do clients have to pick a Medicare Advantage plan, or can they just have traditional Medicare?
Oh, absolutely. We're not trying to push people into Medicare Advantage plans. I sometimes get that question, and I should have mentioned it. No, we were giving you an example of Medicare Advantage plan search just to show you how that worked. But people absolutely can stay in original Medicare. Many people do. If so, we recommend they have a Medicare drug plan, and that's the other side of the website, is comparing your Medicare drug plan options.
Okay. How would we add drugs to an existing drug list and delete them when clients want to play what-if scenarios, if they're kind of curious about different drugs? How would they do that?
Well, in either the anonymous or the logged-in experience, you can add drugs to the list, just like I showed in the demonstration, and see how those would be priced, or you can click the X and remove them from your list to take them back off again.
Okay. Can a beneficiary have the same login and password for the My Social Security and My Medicare accounts? And does the system prevent this from happening?
Well, they're two completely separate systems, so I suspect that there's not that one probably could do that. John, can you give us a more specific answer?
Yeah, that's correct. They are two different systems at the moment. I'm not 100% familiar with their account creation rules, so it might be possible that the same user ID and password could be used on both of those. I'm not 100% sure of those, but they are two separate accounts. They're not the same system.
All right. Have you field tested the Plan Finder tool?
We initially launched this in early July at the 1-800-Medicare call center for the reps to start that. So that was our initial test, but now we're, as you do with all launches, we're expanding that to a greater audience by the launch on August 27th, and we're looking for feedback to continue to improve this. This is an iterative process. We will be adding more features as time goes along, and there are many features that will be added when we actually bring the 2020 plan data online.
Thank you. Okay, we still have questions coming in. The next question is, how can I find a patient's Part D coverage if the patient does not have their Part D card and do not remember their carrier?
So I'm going to guess that question comes from a pharmacist. That can be a little hard. So that patient could contact 1-800-Medicare and find out what their coverage is, or if they have one of these My Medicare accounts, they can log in and you'll see what the current coverage is. But it's basically, just as today, they would need to contact 1-800-Medicare or someone to find out what their current coverage is if they do not have their plan card with them.
Okay. Will medications show for those who are under the age of 65 and on a disability? If
they have Medicare coverage, yes, absolutely. But again, the only medications that will show in our system are I'm thinking of that claims-based list. The only claims that we'll see are the ones they've filled after they have Medicare coverage using some sort of a Medicare drug plan.
Will we have access to explanation of benefits through the mymedicare.gov site?
That's a very good question. So on mymedicare.gov, not the Plan Finder, but on MyMedicare, you have the option of looking at your explanation of benefits online, or the default, they start out, they're mailed to your home, and you can opt to see them only online. You can opt to have them, you can just keep them coming to you by mail, and that brings to mind a common question I've had. people fear that if they create a My Medicare account, it means that they'll only be able to get that explanation of benefits electronically, and that is not the case. They have to take an affirmative action to change from getting a copy by mail to only seeing in electronic form. But they have both options through My Medicare. My Medicare has lots of features that you may want to look at, including the ability to print your drug list, print your health conditions, things like that, to share with a new doctor, things like that. It's definitely worth exploring.
And Ken, just to clarify that, the question was in reference to the EOB, the explanation of benefits,
Yes.
and those would not be seen on the mymedicare.gov. The MSN would be seen on MyMedicare.
I'm using the wrong term, so but we call the Medicare Summary Notice, which is the Medicare equivalent of the EOB you might get from another group health plan. But yes, the Medicare Summary Notices are available on My Medicare, and that was really what I was referring to about electronic versus paper delivery. Thank you.
Okay, great. We just wanted to make sure we were clearing that up. Okay, the next question, is there a way to get more detail on some coverage line items?
Well, it's a little vague. I'm not sure what you're talking about, but in many, many places through the Plan Finder, you'll see links or a little plus sign for places where you can click to get more information. For example, when we were looking at that plan detail page, you clicked on that to get many more details on, in that case, a Medicare Advantage plan. And when you got near the bottom, one of the things was star ratings. And you could click on that and you'd see another huge list of all the many quality ratings for that particular health or drug plan. And you could see how that particular plan rated in each of those. I think there are about 100 different measures. So in many places through there, the whole philosophy of the Medicare Plan Finder is give people up front the information that they most want to be able to make a decision, but have more information available if they want it. Don't flood them with a bunch of information that they don't want to see or that might confuse them. Give them the basic information and then let them click through to get more detailed information or scroll down on that page to get more detailed information if they want it.
All right. Next question is, can we print comparisons?
Yes, you absolutely can.
Well, that was an easy one. Is there a provider finder on the new site?
No, that's what I talked about before with provider directories. We have links to each health plan's website. You can look at their provider directory there. We hope one day in the future, if our interoperability rules are enacted and put in place, that we will have the data to perhaps create a provider search, but that does not exist in the current Plan Finder.
All right. What Plan Finder will pharmacies be using?
Well, for 2020 plans, you'll be using the new Medicare Plan Finder. If you have someone that has just aged into Medicare, just turned 65, or gotten that letter from Social Security that they're now eligible for Medicare, you can use the Legacy Plan Finder, the current Plan Finder, for 2019 plan data only, but your only source for 2020 plan data will be the new Plan Finder.
Okay. Next question, are there password requirements when setting up an account in Plan Finder? Things like symbols, combination of uppercase, lowercase, numbers?
Yes, there absolutely are. It's on one of the slides, so you can link to that. Let me see if I can click back and show you that quickly. So hopefully the slide has gone on the screen. So that password creation guidelines must be between 8 and 16 characters long, must have at least one letter, one number, must contain a special character There's a short list there. Must be different from your previous 6 passwords, cannot contain your username, and cannot contain your Medicare number or your Social Security number. And that triggers another frequent question, which is how often must this password be changed? We have set that to 2 years. You must change your password every 2 years at a minimum. If you're keeping track, My Medicare until fairly recently required you to change your password every 60 days, but for the Plan Finder, we thought that was a little too onerous, so it will be 2 years.
Okay. A few more questions. Will the new Plan Finder show what Medigap policy you currently have?
It will not. Again, CMS does not regulate those, so we do not have access to all of that information. And I'll just leave it there.
Okay. Will the live chat option be available 24 hours a day, 7 days a week during the Medicare open enrollment period?
I believe I know the answer, but John, would you like to hit that one?
Yes, that's correct.
Thank you.
Okay. And will a provider lookup option eventually be integrated in the future?
Well, that's what we've been talking about. John, would you like to address that at all?
Okay. Let's see. I think, we're coming close to 3:30, but before we draw to a close, John, did you have anything else that you wanted to touch on?
Sure, just 2 items quick. Thanks for all the questions. On the printing capabilities, I do agree with Ken, you can print that stuff out. One of the things that we've heard is that there's ways we could make that a bit more efficient, use less paper, that sort of thing. So we're definitely looking at making some improvements there, so stay tuned on that. You definitely can print now, but we can make that better. And just to one point on the call center question, the call center 1-800-Medicare is closed on Thanksgiving, so that's the one exception to that day, and web chat as well. So that's the one day that's not available. Otherwise, throughout all of open enrollment, that's 24/7 availability. Thank you.
Okay, thank you. And Ken, are there any other, I know we went through a lot of questions and you gave a lot of answers, but is there anything that we maybe didn't touch on, any other common questions that you've been getting that you'd like to share now?
I think we have actually hit all of my common questions. Let me look down my list and see if there's something that jumps out here. We do commonly question about for people that have more than 25 drugs on their personal drug list. In the past, they had to call 1-800-Medicare. They couldn't continue with the Plan Finder. We have raised that limit to 40 drugs, so you can you can search for a longer drug list now.
Okay, and actually we just had one more question come into our chat box, and it is, where do you get the drug list from? If someone is new to Medicare, what is the data source?
So if they're brand new to Medicare and they've never filled a prescription through Medicare coverage, then we will not have any kind of a claims-based list. We will only have, it's just like you've always done before, ask them to bring in a list of their medication or bring in their sack of pill bottles, whatever the case may be. So people brand new to Medicare, you got to start somewhere. If, on the other hand, they are new to My Medicare or they're just new as a client for you, but they've been Medicare for some period of time and they have Medicare drug coverage in the past, we will have a record of the prescriptions they have filled in the last 12 months.
Okay, well, thank you so much, Ken and John. We have gone through all of the questions we've received today, and we've had quite a few that were asked a couple times, and we definitely have covered those as well as all of the other questions that we've received. But as a wrap-up, I would like to take a moment to again thank Ken and thank John for all of their information about the new Medicare Plan Finder. And if you have anything that you would like to possibly share, and you are a SHIP, you may follow the guidance that you received from ACL on submitting that feedback. If you are not a SHIP and you have ideas to make the new Plan Finder better, you can email us at emedicare@cms.hhs.gov. And we thank you so much for participating in today's webinar. Just a reminder, we will be sending out an email that will contain the information from today's webinar, as well as a recording as soon as that is available. So be on the lookout for that. And thank you very much. Have a great afternoon.